It's a little after 1 p.m. at Boston Medical Center, and pediatrician Dr. Megan Sandell is receiving her first patient of the day at the clinic, a 2-year-old boy and his mother.
All right, can you show me your teeth?
A routine scenario with one exception. The mother is only 18 years old, and her toddler has no insurance.
I'm very proud of you.
Teenage parents and the working poor struggle with the cost of even basic medical care. And this young mother, who chose not to be named for this story, cannot even go to a pharmacy and buy her son medication.
Well, even paying for, medicine is hard. Financially, it's hard.
Dr. Sandell encounters young families like this every day, and she points out that scenes like this happen all over the country, with low-income families having to make hard choices.
Now, for many people who live in cities like New York or Boston or others, the idea of a family of 4 living on $20,000 a year is an unbelievable stretch. And I think that for our families, those trade-offs are very real, between having to choose between eating and heating their house and paying their rent and coming to the doctor.
But Senator Hilary Clinton, the Democratic presidential frontrunner, hopes to change that. During the fundraising event this month at Boston Symphony Hall, Senator Clinton made sure everyone in the 3,000-person audience knew what she was fighting for.
We must have a health care system that provides quality, affordable health care for every person.
The woman who would be president is fighting a battle she has waged ever since she was First Lady. A universal health care program that ensures all Americans can get the health care coverage they need. Hillary Clinton's campaign manager, Terry McAuliffe, is quick to point out that President Bush has simply not done enough for America's health care, especially with the recent veto of the S-chip bill.
It's almost, for me, words can't describe it. I mean, here he's going up asking for supplementals of $50 billion for new war supplementals, and at the same time, he's vetoing appropriation to make sure children who can't get health care get covered for health care.
But removed from powerful senators and White House politicians, the healthcare war is fought more often by regular people like Dr. Sandell and fellow pediatrician Dr. Marie Clark.
And I think that we really need to stand up to make sure that all children are able to have adequate health care coverage no matter what their means are.
The 18-year-old son, who's fascinated by Elmo stickers and an otoscope, has no idea about the true complications behind his simple visit to the doctor. His mother told me a story about how difficult it was just getting the basic medication to cure an ear infection.
Well, he had an ear infection once, I remember, and it was some other kind of medicine too. They charged me for it.
Hillary Clinton last visited the Boston Medical Center when she first ran for senator, and the question that everybody wants to know is, can she make universal health care a reality? So women like the mother in my story don't have to make so many sacrifices that they can hardly afford. There are currently 47 million Americans who are uninsured, and with the recent veto of S-chip, up to 10 million children, like these behind me right here, could be added to the total. From Massachusetts, I'm Monica Putinichak.